Hi, my name is Ehsan Shiraz and I am a trauma and orthopedic consultant, and this is a patient information video to talk about femoral acetabular impingement. Now, femoral acetabular impingement is actually a new condition. We didn't know much about it decades ago. Only recently we've got a better understanding of the condition, the kind of patients who get it, and what is the treatment available for it. Generally, patients who are very fit, active, sporty, young, they are the kind of patients who usually get this problem. So in simple words, this is what a hip joint looks like. This is a model of a hip joint in a 3D view. The blue surface is the articular cartilage, and as you can see, the hip joint is a ball and socket joint. So femoral acetabular impingement, in very simple words, is that if a normal person can move the hip in this range of motion, people who've got femoral acetabular impingement will have one of two things. Either they will have a small bump here on the neck, sort of there, or they will have a small growth of bone at the top, a cam lesion or a pincer lesion. Sometimes you can have both. And what that does is that if a normal person can bring their hip up to here or bring their hip up to here, due to that excessive bone, you actually hit much before you should. And hence why you get pain, you get impingement, you get restriction of motion, and particularly the exercise or whatever you want to do is restricted. Another condition associated with this condition is that when you've got impingement, there's a labrum inside the hip joint, which is like a rubber-like structure, sort of goes on the margins. And what it does is it acts like a shock absorber. Now, if you've got lots and lots of impingement, that can cause the labrum to tear as well. Now, when we see you, obviously, this is a very complex condition. We assess you. There can be lots and lots of reasons. It can be due to the way you're made, the way your anatomy is, the way your acetabulum, because the hip joint is a ball and socket joint. So could it be that the problem is with your cup? It could be that the problem is with the rotation of your hip. And then how you're using it, whether you're very stretchy, you've got hypermobility syndrome, and all these kind of things, along with your history, how you got the pain. So it's not a very straightforward black and white answer. And for each patient, depending on their presentation, the kind of impingement, the size of the impingement, the labral tear, whether there is one or not, depending on all those things, then only we can give you an appropriate treatment to try and make that better. Thank you so much, and let me know if you have any other questions regarding this condition.